So, go ahead, ma'am.
Good afternoon, everyone. I am Dr. Poornima Mathur, a fertility consultant at Oasis Fertility, Vadodara. Today, we are going to discuss about social freezing, the freedom to conceive at your convenience. So, हम इस बारे में डिस्कस करने वाले हैं what is it, who should go ahead, कब हमारा right time है, and what is it. Let's go into detail. Now, social egg freezing जो है, that is basically the process of harvesting and freezing एक lady के eggs for future use. अनलाइक जो ट्रेडिशनल फर्टिलिटी ट्रीटमेंट्स होते हैं जिसमें हम इनफर्टिलिटी को ट्रीट कर रहे होते हैं, सोशल एग फ्रीजिंग इज टिपिकली यूज्ड बाय इंडिविजुअल्स जो अपनी फर्टिलिटी को प्रिजर्व करना चाहते हैं while they're focusing on other important aspects such as life goals, career developments or personal development. Let's know some more. तो आज हम डिस्कस करेंगे what is the effect of age on your fertility, the effect of age on your eggs, वो eggs जो आगे हमारी प्रेगनेंसी कॉज करते हैं, what is the right age for freezing your eggs? When should you consult a doctor? Whom should you consult? Procedure in a very brief discussion ki how is it done? What steps are involved? And the costing that is involved in it. So normally women जो हैं वो इस dilemma में होते हैं कि where do they focus? Now the peak time when you're peaking अपने career में उसी समय you need to start your family, focus on your biological health and everything. But क्या इस dilemma के में can we manage to strike a balance? So that is what we are trying to discuss. So if we want to discuss ki why is it so important, why are we talking so much about fertility preservation, it is very important कि हम ये जाने कि what is the female fertility timeline, why is it such a hue and cry about the age and the biological aging. So अगर हम females की fertility का timeline देखें तो the peak age जो होती है हमारी होती है between 15 to 35, 18 to 35 to be more precise, and after the age of 35 हमारी natural fertility decline होने लगती है. अगर मैं बोलूँ a lady who's under 30, in every natural cycle she will have a 25% chance that she will conceive. But यही lady by the age of 40 the chances will reduce drastically to just 5%. So this is how the fertility is affected by the age. Now the ovarian reserve that we talk about कि हमारे eggs क्या है. Now in a lady the new eggs जो होते हैं you are born with a set number of eggs. यही eggs है जो आपके partner के sperm से मिलकर embryo बनाते हैं and gives us a beautiful baby. Now female जो होती है that is born with 6 to 7 million eggs उसमें होते हैं which reduces to 1 to 2 million at the time of birth. And approximately in some में से only around 400 to 500 are going to ovulate. Now this reserve is not constant for every lady. It can vary from individual to individual. And despite of the reducing numbers, there are other effects also जो age के हिसाब से हमारे eggs के ऊपर आते हैं. With the decrease in fertility is very slow and steady जब तक आप 35 की age को hit करते हो. But as soon as you hit 35, the decline in fertility is accelerated. The reserves are reduced further. The oocyte quality is severely affected. Now, when we are talking about the oocyte quality, we are talking about the genetic and the morphology. Now, at an advanced age, chances of aneuploidies मतलब chromosomal abnormalities जो हम in a layman बोलेंगे genetic problem आना, that is significantly increased, more so after the age of 40. There is an increased risk of miscarriage and the fertility potential of the lady further decreases. So when we talk about the social freezing, जो egg freezing है, that came into practice somewhere in 2000s. Initially, ये बना था for cancer patients, जिनकी chemotherapy होने वाली है और surgeries होने वाली है, so that they could preserve their fertility. And once they're cured of cancer, they can avail their pregnancy and other life milestones. But gradually, it has evolved into a very viable option for women who are seeking reproductive autonomy. That is, they want the liberty to decide when do they want to plan their pregnancy. So the first question is, who should go ahead with it? Matlab, should I go ahead? So when you want to take a decision whether you should be going ahead with social egg freezing or not, there are different factors जो आपके decision को influence करेंगे. सबसे पहला है you take a call कि I am like this reproductive potential जो मेरा है till 35 or till 40, I do not see myself marrying and settling down and having a baby. I want to delay my childbearing due to my career goals or some other personal goals. That is where you are eligible and you are the most appropriate person to go ahead for fertility preservation. If you are still waiting for the right partner to come along before you get into pregnancy and baby, or you are going to undergo certain medical treatments, say for instance an ovarian surgery, some chemotherapies that may affect your fertility, that is when you can actually opt for fertility preservation. So in a nutshell, अगर हम किसी भी reason से for our career, for personal reasons or for medical reasons हमें पता है we are going to delay our childbearing till 35, we are not planning to go ahead with pregnancy, then you should go ahead and plan your fertility preservation. So when to do it? So like, do I wait till 35? When should I think about fertility preservation? So the best time would be women in their late 20s and even up to early 40s, जो अभी तक who are not yet ready to start a family, but in their future they do have plans of starting a family and want to preserve their fertility while they're focusing on other important aspects of their life. They should go ahead with the fertility preservation. If you ask about the best age that would help us with better results, so anything before 35 or 36 years of age is the best if we want to get the oocyte cryopreservation done. So अगर हम इन एज के पैरामीटर्स को, if we want to talk about in statistics, so अगर एक लेडी at the age of 30 अपने eggs freeze कराती है, her chances of conceiving in a cycle would be more than 40% per transfer. And at the same time, a lady who is in her early 40s or late 30s, may when she's going ahead with fertility preservation, her uski success rate is somewhere going to be 6 to 10%. So hence, you can have your fertility preservation anytime between late 20s till 40s. Best is if you get it done before 35 years, preferably in your early 30s. So when do I know that I might need to consult early? Now, say for instance, if you have an irregular cycle, you have heavy flow during periods, you have excessive pain during periods, आपकी periods में बीच में एमिनोरिया, जैसे periods नहीं आना 2-3 months तक हमारा ऐसा एमिनोरिया होता है, पहले आपकी कोई पेल्विक सर्जरी हो चुकी है, कोई एब्डोमिनल सर्जरी हो चुकी है, कोई ओवेरियन सर्जरी हो चुकी है, अगर आपको कोई मेडिकल डिसऑर्डर्स है, आपकी फैमिली में हिस्ट्री है प्रीमेच्योर ओवेरियन फेलियर, से फॉर इंस्टेंस योर मॉम, उनको अगर 40 से पहले पीरियड्स बंद हो गए, यू हैव एन एल्डर सिस्टर हु इज हैविंग फर्टिलिटी इश्यूज विद लो ओवेरियन रिजर्व्स, या आपकी लाइफस्टाइल इज associated with excessive smoking or drinking or use of recreational drugs. Now this we know, अगर all these factors जो हैं हमारे पास, they can actually severely impact your oocyte quality. So if there is any of these factors present in you, that is when you can opt for this procedure a little early as well. Okay. So now when we talk about fertility preservation, what exactly is fertility preservation? Like, what is the procedure in it? So इसमें बहुत सारे stages होते हैं. The first and foremost is consulting a fertility specialist. So now during an initial evaluation, we usually go through the entire medical history. We evaluate your ovarian reserves. We see what are the different factors. And once we feel that, yes, you can undergo this procedure, it is discussed with you and then you are started with the fertility preservation procedure. इसका procedure is very simple. इसमें बेसिकली जो ओवरीज जो हर साइकिल में आपका एक एग रेडी करते हैं, मेच्योर करते हैं, जो ओव्यूलेट करता है एंड ट्राइज टू अचीव अ प्रेगनेंसी, वी स्टिमुलेट योर ओवरी जिससे हमारे मल्टीपल एग्स बने, विच कैन बी टेकन आउट एंड देन फ्रोजन फर्दर. सो नाउ द ओवेरियन स्टिमुलेशन जो होता है इन अ फर्टिलिटी प्रिजर्वेशन साइकिल would include hormonal injections. Now these hormones are normally there in your body. A short span of hormones is not going to majorly affect you or have some long-term sequelae on your body. That is what we are scared of. कि मैम अगर हम hormone injections लेंगे तो it is going to affect my future fertility, or is it going to have some permanent deleterious effect on my body? So it is not so, since it is a very short duration जिसके लिए हम ये injections दे रहे हैं, and hormones that are normally there in your body, but they are for an elevated level पे हम थोड़ा सा levels बढ़ जाते हैं for a very short span, so they do not have a permanent deleterious effect. They do not have a long term side effect as well, and they are definitely not going to reduce your fertility potential कि हम अभी ये fertility preservation करा रहे हैं तो is it so कि 4 years down the line मैं अगर pregnancy करना चाह रही हूँ तो मुझे problem होगी? No, it is not going to hamper it further. So the first step usually is ovarian stimulation, जिसमें we give hormone injections to stimulate the ovaries. Now these would be given on a daily basis on an average for 10 days. Along with the stimulation, there is ultrasound monitoring of the response of your ovaries, the growth of the follicles. So there are frequent monitoring where your ovaries are assessed with the help of ultrasound, your hormone levels are assessed with the help of blood test, and you would have injections for around 10 days. Once we feel आपके follicles are ready, you have an appropriate response, the hormone levels are corresponding, we go ahead and give you the trigger shot. And then comes इनको बाहर निकालना, taking the eggs out. Now, how are the eggs taken out? There is the oocyte retrieval. Now, oocyte retrieval is कि हम इन eggs को बाहर निकालें, analyze करें, and then we freeze it. Now, the oocyte retrieval is usually done in a short general anesthesia. It is a 10-minute procedure done under ultrasound guidance, mostly done transvaginally. So transvaginal probe जिससे आपके routine ultrasound monitoring होती है, with the help of that probe and a needle attached to it, the eggs are retrieved out in the lab. Now, once ये eggs हम जब बाहर निकालते हैं, it does now, let me clear it, it is not a major surgery, it is a minimally invasive procedure. There is no cut, ऐसा कुछ नहीं होता कि you will have an incision or scar. It is with a small needle puncture that it is done, and it is a very short 10 minutes procedure. Now, these eggs follicles are aspirated, and then the eggs जो oocytes है हमारी lab में assess होती हैं. Now the mature oocytes is now हर oocyte जो होती है, all the oocytes are at different maturation stages. The mature oocytes are the one जो capable होती है to give us baby. So now these mature oocytes are frozen with the help of a step called vitrification. Now this vitrification ensures कि इनका preservation हो सके at a low temperature without affecting the quality of the oocytes. So now oocyte freezing जो है that has drastically improved over the last few years. पहले slow freezing होती थी. The oocytes were not, the success rate with retrieval of oocytes wasn't so good. But of late, with the recent procedures that we use, oocyte vitrification procedure से, the oocytes are minimally damaged. हमारा जो 90% हमारा oocyte recovery rate होता है, like if we freeze 10 out of them, we can definitely get 9 out of it, and a very good embryo formation rate around 50-60%. So this oocyte vitrification procedure has enabled us to get a very good success rate out of frozen oocytes. Now, ये oocytes can be vitrified or frozen for as long as you want. Now, with the new ART law, हमारा ART law says you can freeze up to 10 years, which can be extended further, and you can use it. It is not that कि ma'am, if I freeze it for a longer time, is it going to impact further? No, the maximum has been noted up to 20-24 years कि frozen oocytes have been used to make an embryo, resulting in a pregnancy. And once the oocyte vitrification is done, you might need a rest for that one day. Now, during this entire procedure, apart from the routine doctor appointments that you were needed to visit the hospital for, you can continue your working. You can continue going to your office. On the day of oocyte retrieval, that is where you're expected to take a day off. And from next day, you can actually resume your office activities. So there is no loss of work during the entire procedure. It is just that you might have to take out time from your schedule for the regular monitoring and appointments. इस पूरे टाइमलाइन को अगर हम देखें कि हमारा कितना टाइम लगता है, तो if we have an initial consult where we actually examine you, find you whether you're perfect and you are suitable for going ahead with the oocyte vitrification procedure, any medical abnormalities that need to be corrected, it takes somewhere around, once we start, it takes somewhere around 2 weeks. Within 2 weeks, we can be actually done with the entire procedure. If we include the consultation also, it can take up to 3 to 4 weeks. So this is the entire procedure in brief with the timing and all. So now, when I go ahead with fertility preservation, the question would definitely come to my mind: what is the success rate? Like, does it ensure me a pregnancy? Does, if I go ahead with my fertility preservation, am I very sure that I'm going to get a pregnancy even when I'm planning at the age of 45? So there are various factors which influence the success rate of oocyte cryopreservation. And the one thing that we've been cribbing about so much is the age. Now, the age plays the most significant role. For individuals who are under 35 years of age, they have a success rate of 30 to 50% per embryo transfer. Now, we're talking about embryo transfer, it means when we have your oocytes frozen, we can, now when you need your oocytes, they are thawed. oocytes को हम वापस normal room temperature पे लेके आते हैं, they expand it, and then the sperm of your partner is injected into it with the help of XC machine, and then the embryos are formed. Now, the formation of the embryo and all this would depend upon the quality of the oocyte, which in turn would depend upon the age. So now these embryos are then transferred into the body for further pregnancy. So age plays the most significant role. The more advanced the age, the more poor quality of the oocytes and the lesser success rate. The next important thing is the number of the eggs retrieved and preserved. So now the number of the eggs would depend upon your ovarian reserve, and the number of eggs that are required to achieve a successful pregnancy at a later stage of life actually also depends upon the age at which they are retrieved. So at the age of 35, if I'm going ahead with fertility preservation to get a good successful pregnancy, I might need 10 eggs only. But at the age of 40, I might need 30 eggs, which can ensure me a successful pregnancy outcome. It also depends upon the quality of the embryos that are created through the fertilization. The quality of the embryos would in turn depend upon the quality of the egg, quality of the sperm. The success rate of pregnancy also depends upon individual health. How healthy have you maintained yourself? How is your diet? How are your lifestyle factors? Any other medical comorbidity that you have? Studies have shown that there is no increase in any sort of birth defects or genetic defects with frozen eggs. Even the course of pregnancy after egg freezing is not significantly altered when we are talking about oocyte cryopreservation. So, cost. So now we think that fertility preservation is only for the big shots who can actually afford it, and cost has always been a very significant consideration when anybody is considering social egg freezing. Now, when we're talking about the cost would include the expenses such as the initial consultation that is involved, all the injections, the hormonal injections that are needed to stimulate your ovaries, the procedure of oocyte retrieval, which is done under anesthesia, and the storage, the oocyte vitrification procedure, and an ongoing storage fees for the frozen eggs for how long you want to freeze. The cost would range anywhere between 70,000 to 1.5 lakhs Indian rupees. So it is important that you discuss the financial aspects that are what is needed in your particular case, explore all the different payment options available, and the financial assistance programs that you have. We strongly wish that more and more companies and firms they include fertility preservation in their insurance scheme so that all the women, working women force, have easy access to it. So when we want to conclude it, the oocyte cryopreservation or egg freezing, it presents a promising option for individuals looking to preserve their fertility and take control of their reproductive future. While the success rates can vary based on factors such as age and ovarian reserve, studies have shown encouraging outcomes, particularly for individuals who are freezing their oocytes at a very young age. Consulting with a fertility specialist is crucial for personalized guidance and optimizing the chances of success through oocyte cryopreservation. By understanding the factors which further influence the success rates, making informed decisions, individuals can embark on their fertility preservation journey with confidence and empowerment. Thank you so much. If you have any further queries regarding fertility preservation, please feel free to contact us on the given number. Thank you. Any questions if you have? The age limit for social egg freezing, you can go ahead till early 40s as well. but the age would significantly impact the success rate, the quality, and the number of the eggs. So the ideal would be anytime before 35, but you can go ahead till 40, 42 as well. Can women with PCOS freeze their eggs? Yes, every lady who wants to delay her pregnancy and schedules be in better control of her life with reproductive autonomy can go ahead with freezing their eggs. No, we've answered that in the does egg freezing affect future fertility? No, it is only assuring you. It's like having a savings account in the bank, which makes me confident that if in case I struggle. And with this question, I would also like to answer this thing. Does that mean that if I want to conceive further, it would be only IVF? So with fertility preservation, we are actually being precautious, and we are trying to preserve our fertility. You can definitely go ahead and try naturally, and if in case that works out well and good, and if in case we struggle with fertility issues, then we always have our oocytes to go back to and use them. And egg freezing at an early age is not going to impact your fertility in the future. Thank you so much. Please, if you have any queries regarding egg freezing, please feel free to contact us at the given helpline. That's Dr. Poornima. Thank you so much.